Thank you for inviting us to talk about what we've done here. We're big fans of OpenNotes, and we're happy to join you at this webinar and talk about what we've done. Just next slide, please. So as a little bit of background, we're an ambulatory organization in Vancouver, Washington, so we're not in Canada. And we are ambulatory, and we have an ambulatory surgery center, but we're not a hospital facility. We have about 250 provider FTEs, 5 clinic locations. You can see that we have a high portal uptake. 69% of our patient visits are with patients who have an active portal. And we're not, although we're near Portland, I don't really think of us demographically as being part of the Silicon Forest. So we see this rate as being something that people could achieve in most communities. We don't have a particularly techie demographic, but we still have a high uptake of MyChart. The majority of our patients access through the web portal, and only 17% use the mobile app. We're working on promoting the mobile app because we think that probably is an awareness issue, but that's part of our setup. Next slide, please. So we started on OpenNotes in 2014, and I want to talk a little bit about the change management as we approach this, because I think this is one of the things that is a barrier to implementation in organizations. We brought the concept to our leadership team of managers and department chairs, and at least several people in the room were pretty worried about this idea and what it would mean and whether it would create a lot of extra work and confusion and more questions. So we said, okay, we'll go pilot this. And we piloted it with 4 providers for 3 months, automatically released their notes, and came back and said, you know, it was fine. We had 1 patient correction requested, and it was appropriate. It was a mistake. It's been fine. And tried to use the same dialogue, like what is the right thing to do for the patient. And we fortunately had one of our department chairs say, you know, when my wife and I got complicated medical care, we wanted copies of our chart notes to read so that we could process all that information. If I need it, I'm sure my patients need it too. I think we should go for this. And so we did. We started in July of 2014, and across the organization, default notes to release, except for the ambulatory surgery center and mental health initially. And in August of 2016, we did our EPIC upgrade and found that our note reading rate dropped from 19% to 11%, which we thought was due to their redesign of MyChart, because that seemed to be the only real thing that we could find. Our current note opening rate is sitting somewhere between 22 and 26%, depending on which month you look at. Next slide, please. So when we thought about how to make this more visible to patients, we tried to think strategically, like, what can we do to help patients find these notes? When would they want to read them? When they look at a screen, what do they see? Why are they missing these prompts? Do they know that they're there? How do we walk patients through and point them to their notes? So I think we've had a pretty good response to this, and that's really some of what we want to show you, is how we've customized this so that the patient-facing material is helpful. Next slide, please. So our note opening rate, one of the interesting observations when we were preparing for this seminar is, as we trend things, we see that people continue to read their notes even a month or 2 after their notes are released. And I think that that's really a tribute to the analyst's design of pointing patients to their notes. So they may log in and looking for a lab result or planning to request a refill, but they see a link that says, read your chart note, and hit on the link, and it walks them through and points them to the chart note. So I thought this was a really interesting piece of information. When we went live, we thought, well, we'll send them a tickler, they'll log in the next day or so and read that note, and that's not, people are reading notes at other times as well. So I thought that was worth pointing out. And another thing I want to mention about our note reading rates, when we did this analysis and we looked at individual provider note reading rates, they vary pretty impressively, and some of our providers have note reading rates in the high 60s. Those are typically our obstetrical and gynecology patients, and that department has really encouraged adoption of this. But we also have high reading rates in departments like orthopedics, where I'm pretty confident the orthopedic surgeons are not teaching people about how to use OpenNotes, but their read rates are in the high 40%. So I think there's a lot that's possible to do with this. So let's show you what this looks like, and I'm going to ask Stephanie, who's helped to build some of these tools, to talk about what she's done.
The first thing we asked ourselves is, where do patients know that they have a clinical note to look at? So we thought, well, we need a trigger to tell them to log into your MyChart and look at your after-visit summary, look at your clinical note. So we used the ability that after a patient sees a provider, for the system to automatically generate a message, which also generates a generic email. So a patient gets a generic email, log into your MyChart, and after they log in, they can see their message, and their message is very specific with instructions on where to go, and if they're not quite sure where to go, we have a nice little hyperlink in there to direct them exactly what page they need to go to.
Next slide. Can we have the next slide? Yeah, perfect.
So then we thought, okay, well, other than the message, where will patients expect to see prompts? You know, if they forget to look at their message, where else can we trigger them to make sure that they look at their clinical note? So on the home page, under the News for You, we have a paragraph on what OpenNotes is and a hyperlink, again, to direct them to that past appointment page. And we also have a quick link, as Epic calls it, which is just a fancier hyperlink with a really pretty icon that also directs them.
It looks like a button on the sidebar, yeah.
Yep. And then once they actually find their way to that exact appointment on that past appointment page, there's verbiage on the after visit summary right at the top that says, you know, click on your clinical notes to read your provider's progress note. And we've also changed the name of that tab to be a little more obvious to patients what that note tab is.
So we've relabeled it clinical notes instead of just notes, because we've also felt that notes was a little ambiguous. And this is the terminology that we came up with, and we've been pretty successful in getting there. And I have one more slide here that I wanted to talk about some of our change management. So we had this initial process where we tested the concept with our providers. We engaged them in what were they worried about. We brought them the data from John's studies, the things he's published about this, and we tried to use that measure of what's the right thing to do for our patients. We think of ourselves as being innovative, and we also use that, you know, well, we're an innovative organization, we do what's right for patients, so this is something we should do. And I think I give credit really to the provider team for being brave enough to jump off another cliff with a new process and try this out, and it has really been fine. We had an undiscernible rate of chart correction requests, and I, as our kind of CMIO role, I have only seen occasional comments from patients that they weren't happy with something in their chart note, really surprisingly tiny number. And most of them, I think, were really places where docs had kind of cut corners in terms of writing professional notes. And what I have tried to say to the doctors that are our providers is, remember, your patients have access to the chart already. This isn't a change. This just makes it easier for them, but they have had for, I don't know, 40 years maybe, the ability to get copies of their chart notes. So this is not really a change. You should be writing notes that you are proud of in any setting. And then as we onboard new providers, we talk to them about the fact that we have OpenNotes, and this is an example of how we are patient-centered, how we make decisions with new processes by engaging providers, evaluating the concerns, and so on. And I have to say our new providers generally seem pretty enthusiastic about this. I have not had any horrified providers, at least not that said so to me. And they understand that this is part of trying to build a more collaborative relationship with our patients, so that they understand what's going on and can participate in their care. So that's our story.